Good afternoon, everyone. Welcome to another edition of our LAMP TCM and Acupuncture webinar. Let's welcome Sir Dino Pinheiro from Legazpi to discuss the first topic.
Okay, good afternoon, Doc. Good afternoon po sa lahat. Our topic today is the shui or blood. First, the body color sa normal tongue is pale red. The body shape, not thin, not swollen, not stiff, not flabby, without cracks. Number 3, yung coating niya thin and white, and yung moisture slightly moist, and yung shen with shen, fresh, radiant, and brilliant. So below yung mga pictures po ng normal tongue. Next, we have the topography of the tongue. Yung likod ng tongue, we have the lower burner, yung gitna, middle burner, and yung front is the upper burner. Yung pinaka-front naman niya, please note that the lung area encompasses the heart area. So we could observe that there is lung here in the front and yung tip yung heart. Dito po yung picture, we have a red tip. So this indicates that there is heart heat. And dito naman, the next picture, may mga red spots indicating that there is a lung heat on this area, yung area po ng lung. Okay po. So, here, mga pictures po, we have heart. Yung sa tip, ma-observe po, there is a reddish coloration. Then sa sides, we have the liver naman, reddish coloration. And yung liver and heart, yung sides and tip naman, makikita po dito sa third picture. Sa fourth, we have the stomach, which is in the center area. And pang 5, we have the stomach and spleen. We could observe the sides and the central section. May sa may side, meron pong inflammation. Yung central section, there is tongue crack. And yung last picture, we have yung lungs. Yung front third, kung makikita po, there is swollen po dito sa may lung area. Pale and thin tongues. Lack of blood and body fluid causes decline in volume of tongue body. So there is thinning, shrinking, contracting of the tongue body. Depending on individual's constitution or life circumstances, spleen chi deficiency may lead either to accumulation of dampness or lack of blood. Both are secondary aspects of disharmony of spleen chi. Sa long-term deficiency, there could be impaired transformation of food into blood. Because of this, every pale tongue reflects element of blood deficiency. When blood deficiency contributes to illness, there is yung pale and thin ang tongue body. Yung pale and dry naman, women who suffer from profuse menstrual bleeding, meron siyang breast feed for a long period of time following improper pain. Pag thin and pale tongue naman, sa individuals who suffer from lack of blood, if not treated, yung kidney deficiency may develop yung blood nourishing yin. Sa development of kidney deficiency is visible when pale tongue body changes its shape or takes on intense red or orange tinge. If pale tongue is dry, yung pathology is not so severe. Blood has lost its moistening function, but deficiency is not yet significant. Typically, symptoms of blood deficiency, makikita siyang dry or meron siyang itchy skin, hair loss, pale tinge to skin, numbness in extremities, and meron siyang dizziness. So we have here a case of a male, 41 years old. Yung tongue niya is pale red, slightly thin, rolled up edges. Ibig sabihin yung sides pataas, slightly depressed at the root. So may depression naman sa may likod ng tongue. Yung patient, there is symptoms of deep exhaustion, meron siyang depression, backache, pero sa Western diagnosis, there is none. So, background to disease, ang patient is overworked, hectic lifestyle, there is emotional problems, excessive sexual activity. Sa TCM diagnosis, meron siyang slight spleen chi deficiency, blood deficiency, there is liver chi constraint, slight essence deficiency. So, thank you po for listening.
Thank you very much, Sir Dino. Up next is climatic pathogenic factors. Let's welcome, straight from Rizal, Ma'am Teresita Sumile. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Good afternoon, everyone. Welcome to our new topic, pathogenic factors. Pathogenic factors are the causes for possible imbalances in our body. They can attack our body from outside or inside. Thus, in most cases, causing an initial excess and sometimes deficiencies in energies. When there is an excess, our body resistance or the anti-pathogenic factor opposes this attack by an increase of the energy opposite to the one caused by the attack. For a short time, from 1 day to 30 days, both energies are in the excess state or in struggle with each other. Then, depending on the stronger force, one will gradually lose the battle, bringing about cure or a more subacute state of illness. Pathogenic factors can be classified into 3 categories. One is climatic pathogenic factors. Second, emotional pathogenic factors, and miscellaneous pathogenic factors. Okay. First, we'll take up climatic pathogenic factors. The 6 climatic pathogenic factors are summer heat, cold, damp, wind, dryness, and fire heat. The climatic pathogenic factors can attack the body from the exterior, trying to cause heat, cold, or damp symptoms in the exterior. The immune system or the anti-pathogenic factor fights back, trying to protect the body from being injured. For a period of time, there is a fight between the two, the climatic factor and the anti-pathogenic immune system, and there is an excess of both yin and yang energies. If the pathogenic factor was yang in nature, the anti-pathogenic factor, the body would fight with his yin and vice versa. So kung ang pathogenic factor is a yin in nature, so the yang anti-pathogenic factor of our body will also fight with it. So if and at the end, the struggle, it may be that the body resistance would win and the pathogenic factor is eliminated. So it also could be that the immune system may fail and weaken, so that the pathogenic factor enters the interior of the body and becomes endogenous pathogenic heat or wind. Okay? We all have the experience that sometimes we feel out of sorts. as if we are coming down with flu or common cold. If we take it light that day and go home to have a warm spicy soup and get into a cozy bed, we may wake the next day as right as rain. So, or we might be worse off the next day and wake with a body cough and fever. Now, when the climatic pathogenic factors enter the interior of the body, they produce similar symptoms in the body as exterior heat, wind, or damp. For instance, the manifestations of heat are fever, feeling hot, excessive sweating, excess thirst, red color, restlessness. Cold symptoms are feeling cold, shivering, feeling stiff and numb, and general slowing down. It does not necessarily mean that heat or wind must only enter the body from the exterior. The same imbalance states in energy can arise from other causes, not all exterior or climatic. For example, excessive mental stress and head work can increase heart yang. Too little sleep or anxiety about work can cause the same situation. When the heart yang becomes hyperactive, one has similar symptoms as exterior heat would cause. Another example is that excessive sour food or alcohol increases the liver wind, causing irritation to different areas of the body. This manifests as the same symptoms as those caused by exterior wind irritating the liver. These climatic pathogenic factors can also generate from the interior. For instance, the female hormones decrease in menopause. The reproductive system is connected to the kidneys. So we can say that the kidney yin decreases in menopause. These women not only suffer from severe general dryness, but also from heat flashes and night sweats. They get symptoms such as tachycardia and restless sleep. This is an example of interior heat arising from internal dryness. It is customary to call these symptoms by the causative climatic factors and those that they resemble. Thank you so much for your attention.
Thank you very much, Ma'am Teresita. We move on to the next topic, which is yin and yang relationships. We will continue where we left off last time. Now let's talk about the chronic state. During the chronic state, either the yin or yang energy is deficient. Energy in a weaker position would not be able to control the other side effectively. So dominant side, therefore, can increase from time to time, thus causing several semi-acute states. Recurrent migraine headaches provoked by too much stress, light, or alcohol, and these are all yang causes, are good example of yang rising from time to time on a yin deficient base. Another example would be recurrent asthma with excessive mucus or fullness of the chest in wet and cold weather. Good example for yin or damp increasing from a yang or qi deficiency situation. The changes are always predictable because a chronic indeficient state can only lead to yang increase from time to time and vice versa. So a yin deficiency state can lead to a hyperactive yang in the same way that a yang or qi deficiency state can lead to stagnation of yin. In energy balancing treatments, the diagnosis is already half the treatment because we decide the points accordingly. So therefore, diagnosis is quite important. Acute conditions must be sedated. If yang is excess, we sedate the yang. If yin is excess, we sedate the yin. If both yin and yang are excess, we sedate both the yin and yang, or we sedate whichever increased first. Chronic conditions need to be tonified. So if yang is deficient, we tonify yang. If yin is deficient, we tonify yin. So if both yin and yang are deficient, we tonify both. When both yin and yang are in excess, it is often because one side increased initially and the other side reacts to this increase by increasing itself as well. This reaction is possible as this is a recent disease state and both energies are still healthy. It will not be possible for the opposite side to react with it increase in itself if the disease state is subacute or chronic, as this side would have become weaker over time. Subacute states need both tonification and sedation. So if you have a hyperactive yang, we tonify the yin and sedate the yang. If there is stagnation of yin, we tonify the yang and sedate the yin. So this is for subacute states. In recurrent states with chronic history, treatment is different depending on whether we treat during acute phase or at interval. So at interval, the treatment is only to tonify the deficient aspect. During acute phase, this is treated like in the subacute state. Increase of both yin and yang with the symptoms of both energies, we can treat this with sedation of energy that increased initially. So the first that increased. When this is sedated, the reacting side will decrease of its own accord, as it will not be necessary for it to oppose any excess. For example, when you feel hot, you sweat excessively. If yang can be sedated and the body is cooled, there would be no sweating. Both yin and yang are always within each entity and they always relate and react to each other. This reaction follows a predictable pattern. So knowing this pattern helps to treat patients' problems with a view to its possible changes. Acupuncture is based on way of nature, so very natural, on wisdom achieved through many years of observation of nature, human life, and its changes. Understanding of yin and yang and their interrelationship will help us observe, predict, prevent, and treat symptoms of disease in their changing phases. And these relationships are contradiction, interconsumption, control, and intertransformation. And we shall discuss them one by one. Thank you very much for listening. We move to the next. Let's now listen back to Sir Dino Pinheiro from Legazpi for the 5 elements. Good afternoon, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. Now, continuation tayo sa fire elements. Okay, the concept. So we have here the heart and small intestine, yung heart, which is the yin dominant, and the small intestine, which is the yang dominant. Yung heart houses the mind, governs mental activity, concentration, memory, creativity, and sleep. Nourishes the blood and blood vessels. Circulates blood and heat, secretes sweat. Communication, yung speech and expression. It opens to the tongue. The color is red and emotion is joy. Yung flavor is bitter. Yung climate is heat. And yung coupled yang organ is the small intestine. This is the first element that we shall study together and would like to start by explaining the lower diagram. In the center is the heart and the small intestine, and surrounding them are all their associations. Most of these aspects, such as mental activity, sleep, nourishing blood, secretion of sweat, speech, and emotion, are mainly related to the yin organ, the heart. It is the heart that circulates blood and heat, and not the small intestine. But the heart and small intestine are coupled organs, and this means that they have an interior-exterior relationship. Through this interior relationship, energy flows from one organ to the other, from where it is high to where it is low. If heart yang rises, it would flow to the small intestine. And if the small intestine cannot rid of this excess yang, then the small intestine yang would become excessive as well. So, palipat-lipat po. As long as the small intestine yang was not in excess, heart yang will flow to the small intestine and be reduced to normal. If the heart yang become deficient, so yung heart yang deficient, then the small intestine will try to fill in that deficiency. So pag deficient yung heart yang, yung small intestine mag-fill up. And if the resources to replenish small intestine yang become depleted, so habang nag-replenish yung small intestine, siya po ang na-deplete, then the small intestine would become yang deficient in due course. The coupled organs usually have the same picture of imbalance, unless the energy flow between them is blocked for some reason. However, they have their own division of labor, and there are specific functions for each of the coupled organs. If one of them is imbalanced, the other is affected almost instantly because of the interior energy flow that connects the two organs. The interior relationship between the coupled organ is taken into consideration when treating the imbalanced state in either of the two. Heart houses the mind, governs mental activity, memory, and creativity. The brain consists of marrow, which is a substance that belongs to the kidney. Although the kidney make the brain marrow, the brain function relates to the heart. So, for instance, yung Alzheimer's disease, which result from loss of brain cell, is caused by deficiency of kidneyin. So, nagbabawas po yung brain cells. It indicates that there is a deficiency of kidneyin, but the earliest symptoms naman is loss of memory, which is caused by deficiency in heart yin as well. So, sa memory, ang heart yin ang affected. If our brain is active and our head gets warm in the process, it is our heart chi that is responsible for this brain activity. So the greater our intelligence and brain activity, the higher the heart chi will rise. The heart chi is the function, and the heart blood provides the fuel for this function. Heart blood and yin are reduced through the day during our brain activity, but are replenished daily through sleep and relaxation. So thank you po for listening.
So that was very interesting, di ba? Now we know. Okay. Let's proceed to the next. Thank you very much, Sir Dino. Up next is Essence. Ma'am Teresita will start on a new topic, the Jing or Essence. Hello, Ma'am Teresita.
Hello po, Dr. Hector, and sa lahat na po. Now let's take up functions of essence. Essence forms basis of root of life, and it is the origin of yin and yang in the organism. Essence composed of earlier heaven essence called congenital essence, inherited from the parents and constantly supplemented by later heaven essence called acquired essence, produced from food by stomach and spleen. And we have three treasures of life. We have the Jing, the Qi, and the Shen. Now, essence often referred to as essential Qi, and because it is stored by the kidneys, it is also called kidney essential Qi. Okay. Now, congenital essence is the product of combination of sexual energies of man and woman at the moment of conception. It nourishes fetus during pregnancy, okay, as it is illustrated. It determines basic constitution of the human being, makes each individual unique, and congenital essence cannot be increased, okay? Congenital essence determines quality of yin and yang in the human being. If yin aspect of congenital essence is weak, yin deficiency is likely to develop after birth. If yang aspect of congenital essence is weak, yang deficiency is likely to develop after birth. So, ang fetus to be considered as healthy, he should have a balance of yin and yang energies upon birth, okay, as illustrated. Weakness in congenital essence causes weak constitution, can manifest already in childhood years, okay? So as it is illustrated, bata pa lang sinisipon na. Acquired essence, same as essence of grain and water from which chi, blood, and fluids are produced. So it is illustrated here that the spleen transforms the foods in the stomach, and then the pure components of forming it into good chi, and the pure components of good chi will be transported to the lungs, and then the stomach now descends the impurities downwards for further refinement. Okay? If organism uses up more energy, acquired essence, than it produces, then acquired essence is weakened and depleted. So we have here observation in TCM about weak kidney essence. So symptoms are receding hairline. So medyo bata pa siya pero bald na siya. At decreased vision o nakasalamin na bata pa lang. And then difficulty in hearing, premature gray hair, crooked teeth, and weak bones. Kidney essence is formed from congenital essence and acquired essence, stored in the kidneys in liquid form, and can be supplemented by acquired essence. Kidney essence determines growth, reproduction, development, sexual maturation, conception, and pregnancy. It generates marrow and is basis for constitutional strength of human being. So here it is illustrated that Jing in the kidneys produce marrow, and then the bone marrow nourishes the bone to have strong bone development. Okay? Kidney essence forms basis for sexuality, material basis for male semen or female ovum. Forms material basis for kidney yin and kidney yang. So now let's go to the functions of kidney essence. Number one, it produces marrow. Then it is the basis of the constitution. Then kidney essence is the foundation of the three treasures: essence, chi, and mind. And it also determines growth, reproduction, and development. And then it is the basis of kidney chi. Okay? Yang aspect of the essence provides basis for kidney yang, referred to as Ming Men, the source of life. So we have here the functions of Ming Men fire. It assists the lungs for better breathing. It harmonizes sexual functions for a healthy libido. It warms spleen and stomach for being better digestion. It warms the lower jaw for better bladder function. And it's the source of yuan qi and assists the heart in housing the mind. Okay? Kidney yang has function of warming all other organs. Only with this support can organs fulfill their respective functions. So in yin-yang philosophy, kidney yin and kidney yang should always be in balance. Yin aspect of essence provides basis for kidney yin. Yin aspect nourishes yin of all other organs and is origin of marrow and birth. Next slide, Doc, please. Kidney essence controls different stages in life: birth, puberty, menopause, and death. Okay. Aging is physiological decrease of essence. Signs of age like bad memory, deafness, hair loss, and graying are signs of decrease in kidney essence. Thanks for watching.
Thank you very much, Ma'am Teresita. We now proceed to Zangfu organs, and we shall continue with our discussion of the spleen. This time we talk about the pathology of the spleen. Let's start with spleen qi deficiency. Spleen qi deficiency leads to impairment of spleen functions. This is the initial stage of spleen yang deficiency. So this is the precursor of spleen yang deficiency. Cardinal symptoms: lack of appetite, sensation of fullness after meals, fatigue after meals, soft, odorless stool, diarrhea, edema, overthinking, and teeth marks on the tongue. Lack of appetite is due to the fact that the spleen function of food transformation is impaired. So the patient will not have appetite or will lack appetite. The sensation of fullness after meals is explained by the fact that there is an impairment in the spleen function of food transformation. Fatigue after meals is due to the fact that the qi production of the spleen is impaired. The pale facial complexion means that the qi is deficient and the transportation function of qi and blood to the face is impaired. Weakness of extremities, because the extremities are governed by the spleen. Spleen qi deficiency leads to impaired transportation of qi and blood to extremities. Soft stools or chronic diarrhea with undigested food particles in the stool. This is because the spleen function of food transformation is impaired and dampness accumulates. Overthinking because of impairment of mental digestion. The edema because the spleen function of food transformation is impaired and dampness accumulates. Spleen is particularly susceptible to dampness, and this affects transportation and transformation. Impairment of spleen's function affects the transportation and transformation due to other causes, and this may easily give rise to dampness. Spleen is the source of dampness. Even if dampness manifests in other organs, Spleen must be treated so that dampness won't be produced again. Being excessively focused on oneself. So all you think about is yourself. This is due to impaired mental digestion. Spleen yang deficiency. This is the further development and complication of spleen qi deficiency. Qi is part of yang. Spleen yang deficiency includes signs of spleen qi deficiency. The essential difference is additional cold signs present in spleen yang deficiency. Cardinal symptoms. Of course, this would include symptoms of spleen qi deficiency, plus undigested food particles in the stool, feeling cold, feeling chilly, cold extremities. There is also lack of appetite because of impairment of the spleen function of food transformation. Sensation of fullness after the meal because of weakened spleen function of food transformation. Fatigue after meals because of impairment of spleen qi production. Facial complexion is pale because qi is deficient and the transportation of qi and blood to the face is impaired. The extremities are weakened because extremities are governed by the spleen, and since we have spleen qi deficiency, this will lead to impaired transportation of qi and blood to the extremities. Soft stools or chronic diarrhea with undigested food particles in the stool, so the spleen function of food transformation is impaired and dampness accumulates. Undigested food particles in the stool. Spleen function of food transformation is impaired and dampness accumulates. There is stomach ache, which improves with warmth, which means that the spleen yang functions of the transformation and warming are impaired. Feeling chilly. That means there is an impairment of the warming function of spleen yang. Cold extremities, because the warming function of spleen yang is impaired. Overthinking, because of impairment of mental digestion. Spleen function of food transformation is impaired and dampness accumulates, leading to edema. And we have mentioned earlier that the spleen is particularly susceptible to dampness, and this affects the TNT, or the transportation and transformation. Impairment of spleen's function affects transportation and transformation due to other causes, and this may easily give rise to dampness. Spleen is the source of dampness. Even if dampness manifests in other organs, the spleen must be treated so that dampness will not be produced again. And being excessively focused on oneself means there is impaired mental digestion. Thank you very much for your attention. And we now give you Sir Dino Pinheiro for the next presentation, who will talk about the meridian theory. Good afternoon, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. Okay, we continue to the meridian theory, stomach channel of the foot yang Ming. Okay, good afternoon, Doc. Good afternoon po sa lahat. Continue po tayo sa meridian theory, stomach channel of foot yang Ming. The stomach meridian starts below the eye, near where the large intestine meridian ends. It does a U on the side of the face ending at the temple. So there is letter U na curve po yung path ng stomach meridian. The rest of the meridian flows on the neck, thorax, over the breast, the abdomen, and the front of the thigh, shin, foot, and ends on the lateral side of the second toe. It is the only yang meridian which does not follow the rule that yang meridians flow on the lateral and dorsal sides of the limbs and body. The meridian flows on the front of the body and the legs. So, nasa harap po siya ang path ng meridian. The inner branch flows parallel to the exterior meridian on the thorax and abdomen, entering the stomach and the spleen. Another branch is given off at point stomach 36 and flows to the big toe, to spleen 1, and to the third toe. So first, we have the stomach 1. The location with the eyes looking straight ahead directly below the center of the pupil, between the eyeball and the infraorbital ridge. So dito po yun sa may mata. The point explanation, the first point and point of entry from the former large intestine meridian. Stomach 1 is very effective point in the treatment of eye diseases such as optic nerve atrophy, short sight, macular degeneration. When treating the eye problems, this point is needled between the optic ridge and eyeball into the optic cavity, about 2 centimeters deep. As an entry point on the superficial energy circulation, it can be needled subcutaneously 2 to 3 mm. So, tingnan po natin yung location ng stomach 1 dito po sa may mata. Next, we have the stomach 3. Ang location niya with the patient looking straight ahead, directly below the center of the pupil. So, i-align po sa center ng pupil on the level of the lower border of the ala nasi. So, a point explanation, a local point for maxillary sinuses, as it is quite close to the point LI20. It is often needled towards it. So, pag needle, papunta po sa may LI20, getting both points with one needle. Okay, dito po sa may side ng nose. Stomach 4, next point, we have, it's located with the patient looking straight ahead, directly below the center of the pupil, approximately 0.4 chin, lateral to the corner of the mouth. So, i-align din ulit sa center ng pupil, then sa may side po ng mouth. Point explanation, this is used mainly for the lips, cracks, or inflammation at the corner of the lips, or in facial paralysis when the corners do not turn up into a smile. This point should be given with skin pinch and needled away from the corner about 2 cm deep. So, ipipinch po yung skin, saka po manidel. Pa side ng corner ng mouth. Next, we have the stomach 6. Ang location with teeth clench on the highest prominence of the masseter muscle, approximately 1 finger breadth, yung middle finger, anterior and superior to the angle of the jaw. So, ito po ay bite natin yung patient and yung higher prominence po nung dito sa may jaw, yun po yung stomach 6. Sa point explanation, the best use of this point is for teeth grinding during sleep. So, may mga pasyente na nag-teeth grinding habang natutulog. Ito maganda po itong point. In fact, more tender points could be found in this patient along a circular line drawn from one stomach 6 to the other, both front and back. The other points on this line are triple warmer 17. Dito po yan sa may likod ng ear, GB12. Dito din sa may back ng head, and GB20. These are tender, so we have to palpate these points. Kung may tenderness, they should be needled as well. So, isasabay po natin siya pag needle. Kung pag palpate, there is tenderness. In this case, and in the case of temporomandibular joint pain, the needle should be given perpendicular 15 to 20 mm into the point. This is a good point for acupuncture analgesia for tooth fillings or extraction in the lower jaw. So magagamit natin ito para sa mga may mga problems sa tooth or before magkaroon ng treatment sa dentist. If used, it should be stimulated for 20 minutes prior to the procedure with continuous electrical stimulation along with one more point on the same side. So, pwede rin gamitan natin ng stomach 6 kasabay po ang LI4 on same side. Sa location ng another point, stomach 7, with the mouth closed, sasara po yung mouth, the lower border of the zygomatic arc in the center of the depression of the mandibular fossa between the coronoid process and the condyloid process of the mandible. So pag pinalpate po natin yan, may parang malambot na area dito sa may mandibular depression sa mandibular fossa. Sa point explanation, this is another point that is used to treat TMJ pain and is used as an acupuncture analgesia point for upper jaw problem. So sa may mga masakit po sa upper jaw, we could use stomach 7. The insertion in both cases is at 45 degrees angle towards the point small intestine 18. So pakatusok po natin towards the small intestine, magkakaroon po siya ng angle na about 45 degrees. Next point, stomach 8, which is at the temporal corner of the forehead. Siya po yung naglihis na stomach point on the border of the temporalis muscle. And 0.5 tune within the anterior hairline. So paangat po siya 0.5 tune and 4.5 tune lateral to the anterior midline. So from the midline ng head, maka-count po tayo ng 4.5 tune pa side. Then another 0.5 tune paangat anterior sa hairline. Sa point explanation, when the patient complained of a lateral or temporal headache, ask them if it occurs on one side at a time or on both sides simultaneously. They are pointing to both temples at the same time. This is a stomach meridian headache and not GB headache. So the point is most possibly stomach ache. So tatanungin natin ang pasyente kung ang both temporal area is masakit. We could say that this is a stomach ache headache and not a GB headache. It is the point that hurts when one has a low blood sugar headache. So pwede rin kung mababa ang blood sugar, ito po yung stomach ache ang sumasakit. In this case, it should be also disappear after eating and not after needle. So if there is low blood sugar, ask the patient to have their meal or snacks. The point can be needled perpendicularly 5 to 10 mm deep. Okay. So thank you po for your attention.
Thank you very much, Sir Dino. We now proceed to the last but not the least topic, breathlessness. Identification of patterns and treatment. For treatment of breathlessness, we need to differentiate excess from deficiency. In the excess type, breathing is shallow and long. Person exhales quickly with a loud noise. There are loud wheezing sounds, cough, and the pulse is slippery or tight and full. In the deficiency type, breathing is short and rapid. The person inhales quickly with a low noise, weak pulse. The complete book of Jing says, in excess breathlessness, breathing is long. There is a feeling of oppression of the chest. Breathing sounds are loud. The person cannot hold the breath in and breathes out quickly. In deficiency breathlessness, breathing is short, person is flustered, chi is weak, breathing sounds are weak, breathing is interrupted, and is worse on exertion. For treatment of excess conditions, we should treat the manifestation first. We have to concentrate on treating the manifestation and on expelling the pathogenic factors. For deficiency, we have to concentrate on treating the root and tonifying the body's chi. For example, in breathlessness from phlegm heat, so this is excess, the manifestation, even though it is spleen deficiency, which is the root that leads to phlegm, the first priority is resolve the phlegm and clear heat rather than tonifying the spleen. In chronic breathlessness from deficiency of lungs and kidneys, the root, primary task, we tonify lungs and kidneys. And we only secondarily relieve breathlessness and possibly resolve phlegm, which is the manifestation. The patterns that will be analyzed are the following. For full, we have wind cold invading the lungs, wind cold on the exterior, phlegm fluids in the interior, cold on the exterior, heat in the interior, phlegm heat in the lungs, turbid phlegm in the lungs, lung chi obstructed, liver fire invading the lungs. For the empty conditions, we have lung chi deficiency, lung yin deficiency, lung and kidney deficiency, lung and kidney yin deficiency, lung and kidney yang deficiency, fluids overflowing to heart and lungs, lung, heart, and kidney yang deficiency, fluids overflowing to the heart. So let's talk about the full pattern of wind cold invading the lungs. There is aversion to cold, shivering, fever, cough, breathlessness, feeling of oppression of the chest, thin white mucus. So this is very wind cold, headache, no sweating, pulse floating and tight. External wind cold invades the defensive chi or the wei chi, and it impairs the diffusing and descending of lung chi. So this is the one that causes breathlessness and cough. This situation corresponds either to acute attack of breathlessness or acute exacerbation of chronic breathlessness. At this acute stage, treatment should be aimed at releasing the exterior and expelling wind cold, even in chronic breathlessness. Treatment principle: release exterior, restore diffusing and descending of lung chi, expel wind cold. Points: lung 7, lung 6, bladder 12, bladder 13, and Ding Chuan, an extra point. These are all reduced with cupping on bladder 12 and bladder 13. Direct moxa with cones applicable to bladder 12 after needling and cupping. Lung 7 releases exterior, expels wind cold, restores diffusing and descending of lung chi. Lung 6 is a chi cleft or accumulation point. This is used for acute lung patterns, stops breathlessness. Bladder 12 and bladder 13 with cupping will release the exterior, restore the diffusing and descending of lung chi. Moxa can be applied after needling and cupping if cold is predominant. Then the extra point, Ding Chuan, which is 0.5 Tsun, lateral to Du 14, will stop acute breathlessness. So Ding Chuan is a very important extra point. Thank you very much for your attention and hope to see you tomorrow. Thank you, everyone.